Hello guys, welcome back to my channel where we discuss how to think, not what to do as a body contouring specialist. So today I want to talk about a very important modality that is on your body contouring machine, why it's so important, and why you need to use it. Now, I have noticed in my Facebook group specifically lately, I have been seeing some specialists commenting under different posts talking about how they do not like to do the vacuum therapy treatment on the stomach area. And if you know me and how I teach, you know how passionate I am about lymphatic drainage, how I'm constantly reiterating to drain, drain, drain in every single, one of your sessions. It is the most important way to start and end a body contouring session, okay? Because without moving fluid, we are at risk of clogging up the lymphatic system and we will not see results. So this topic can be a little controversial, I guess, but it is something that I push very heavily in my online classes and in-person classes. So instead of just telling you about it, I want to go into why and my reasoning behind everything I teach as I do. So we have our cavitation, we have our radio frequency, we have our laser lipo, and then we have our, last but not least, our vacuum therapy tool. Okay, now this tool is very beneficial for fascia release for cellulite, creating microcirculation and bringing fresh blood to the surface of the skin, which is very important in our body contouring treatments, as well as moving lymph through the body. Okay, and it does so using something called negative pressure. When it comes to normal massage, we are pushing down, so we are creating positive pressure. With our vacuum therapy tool, we are lifting up, so we are creating negative pressure. And when we apply vacuum therapy to the tissue, we are doing a few different things at once. We are creating pressure that pulls stagnant fluid out of the interstitial space. We are stretching the anchoring filaments that are attached to the initial lymphatic capillaries and pulling them open to increase fluid uptake. And we are encouraging movement through a system that has no pump because the lymphatic system relies on external forces in order to move the fluid. So the idea that vacuum therapy causes fluid retention in the stomach is actually backwards. When it's used correctly, it does the exact opposite. It moves fluid that is already stuck. Now, when you are working on your clients, it is super important that you are incorporating some form of lymphatic drainage, whether that be through your hands if you're a licensed LMT, wood therapy, or your vacuum tool. There have been studies showing the positive effects that negative pressure has on being able to move the fluid. And when working on the stomach, we need to keep the cisterna chyli in mind. And if you don't know what that is, it is a dilated sac that acts as a reservoir or a tank for the lymph from the lower extremities. So all the lymph from the lower limbs, the pelvis, the abdominal organs, and the intestinal trunk all get sent to the cisterna chyli before it sends it upwards to the thoracic duct and empties into the bloodstream near the left subclavian vein. So think about what this means for a second. Almost all of the lymphatic fluid from the lower half of the body has to pass through one region in the abdomen. When the cisterna chyli is congested, sluggish, or not functioning the way it should be, what do you think happens? Fluid backs up in the lower body, pressure builds in the abdominal cavity, the intestinal trunks can't drain efficiently, and yes, the abdomen gets distended, the client feels bloated, and the lower body holds onto more fluid. So the bloating that people are blaming on the vacuum, a huge portion of that time, it is a result of a lymphatic system that was already sluggish before the session started. So the vacuum didn't cause it, it just exposed it. It exposed a lymphatic system that was already struggling to keep up. And if there was no priming of the lymphatic system to begin with, especially on a client who really needed it, yeah, that's when bloating can occur as well. However, I do want to be fair here because there is a scenario where the vacuum therapy tool can contribute to post-session bloating, but it's not the tool's fault, it is how it's being used. When a specialist gets too aggressive with suctioning on the abdomen or using too much intensity or working over a region without much respect for the underlying anatomy, then yes, you can absolutely cause inflammation. You can create microtrauma or something that's called temporary inflammatory fluid response. But that's a technique problem. It is a training problem. It is not the modality being inherently dangerous. A trained specialist who understands lymphatics, body mapping, and how to use their machine is not creating bloating with vacuum therapy. They are resolving it. And this is what I want you guys to realize is that the body contouring industry has a misinformation problem. People are making videos about the treatments and the body without understanding the anatomy underneath any of it. They see a result of something, which in this case is bloating after using the vacuum. They guess at the cause, they post the video, and now thousands of specialists are afraid of using a tool which, when used correctly, is one of the most powerful things that they have. If you've ever been bloated after a session, the answer is not to avoid vacuum therapy. The answer is to understand why your body responded the way it did and to work with a specialist who actually knows what they're doing. If you're a body contouring specialist, please start taking education from someone who can actually explain the cisterna chyli, why bloating is occurring, and also how to fix it. Stop blaming the tool and start looking at the technique and the anatomy. If you're seeing bloating, you are missing a big piece of the physiological puzzle. There is a certain way to prep the body and a specific logic as to how we use these machines to make sure that we are draining. This is exactly the kind of stuff that I teach in a Body Vibe Academy, and more specifically in the Contour Room membership. I go over the anatomy, the science, the why behind why I tell you what to do, because I like to have a valid reason for everything that I teach. And guys, there are studies that show how effective vacuum therapy is and negative pressure is on moving fluids. So I'll put some links in the description for you as well. So if this opened your eyes, hit subscribe, because I'm going to be calling out a lot more myths like this, as well as going in depth with our body and the treatments and how it all works together to create beautiful sculpted results. And make sure you drop a comment letting me know what other myths you want me to break down next. I will see you in the next one.